Good morning to our Meadowview and Fleming family. We are coming to you today through Teams. We did host our Q1 town halls in March, and we did receive feedback that many of you were not able to get away from your work areas, but we're still interested in hearing the message. So thank you for providing that feedback. Today, we have a number of our leaders that will present the town hall to you, and we're able to record it and send it out to each of you so that way you can review it at your own desktop and location. So we'll get started with Steve France, who will review our capital budget.
Good morning, everybody. I'm your interim CFO, Steve France. Thanks for joining us today. Providing you a list here of the 2025 capital purchases. You can see there was a sizable investment in this market of almost $1.5 million last year. And really just want to provide this to give you kind of an idea of the scope of the types of things that were purchases, and just to let you know there has been a sizable commitment from LifePoint and the corporate office in terms of their support and providing capital resources for us. In addition to that 1.5 million, you can also see below some larger projects that went through: wound care center and a new hood for the pharmacy. Both projects over $1 million. Those were also approved last year. We go to the next screen. This is just the start of 2026. You know, the numbers are not big yet, but there are some more items in process. The big item of note here is we have an additional approval for replacement of our MRI. That should begin probably here in April, maybe May, probably go through the end of the year. We may not see that new MRI up and operational until January of next year. But it has been approved and we are moving forward, and we're very lucky to have that support.
Thank you, Steve.
I think that's it.
Appreciate it.
You're welcome.
Next, we have workplace safety. We have noticed here at both facilities that we're starting to see an increase in patients that are hostile or that are aggressive. We recently met with both the sheriff's department and the police department, and unfortunately, they are seeing the same increase in their runs as well. We did work with both the sheriff's office and police department to try to figure out a way to have off-duty officers here when we do have patients that are very violent. So more to come on that. But in the meantime, we heard from several team members that expressed concern. They weren't sure if they could call 911 in an emergency without first asking permission. So sharing today the flyers that we put together, they should be posted in your areas, whether it's the break room or any communication boards. If you feel like you're in an immediate danger at any time and you need assistance from law enforcement, please feel free to call 911. You do not have to ask permission first. The local law enforcement teams would rather arrive and then everything is diffused and there's no issues, versus someone hesitating and then getting harmed in the meantime. We do have panic buttons as well installed in several of the areas throughout the hospital. So feel free to utilize the panic button and or call 911 if you feel an immediate threat. Otherwise, work with the PCC and use the proper codes overhead to get help to your area. All right, turning it over to Heather to review our network.
Thank you, Kathy. So when we did this meeting live, we didn't have the Spectrum redundancy, but now we do. So we're currently on like a temporary network right now where we have a redundancy through T-Mobile. So when we have network downtime, it's not impacting radiology. It still will impact the nursing side, which we have mobile hotspots and guest Wi-Fi that we can put users on until we get the Spectrum to the T-Mobile to Starlink. That's the end goal, and we are also working with Spectrum to do another redundant line so that we'll have a basically to take away Windstream, and that way we have a better connection for our network. Everybody knows that's kind of been like a problem for the last 6 years, so we are actually working to get that resolved. So we do have redundancy now. We're just working on that end goal to get the T-Mobile to Starlink.
Thank you, Heather, and thank you to you and your team. I will say that Heather and her team have worked many hours, weekends, nights, whenever our network goes down to get us back up. And then currently working now with our team at the HSC to get approval for some of these new options for us to have redundancy. And we are one of the first hospitals to go live with the T-Mobile and Starlink. So thank you, Heather, to you and your team for that hard work.
You're welcome.
All right, David.
Thank you, Kathy. So I want to talk to you about the different communication platforms we have. One thing that we notice is a lot of people said they don't know about things. So we're trying to utilize as many as we can. So of course you have your email, which is one of the main sources that we send things out. We also have our social media, which each hospital has a Facebook page. We are not allowed to have a TikTok page. Some of you have asked, and no, we're not allowed to have them. We're not allowed to have an Instagram page. Some hospitals do have them because they had them before they decided not to let us have them, and they were able to keep theirs. Another communication tool, we have Kathy's Take 3. Kathy and I are trying to do better and get one out each month. We did miss a month, but we were going to get back on track. And that's just a little quick update about what's going on, what news is happening within the hospital. And then you have your First Up app. If you do not have that yet on your phone, Kyle has been sending out directions on how to download that for your phone. I know when it first came out, a lot of people were worried that they're tracking you. They are not tracking you, okay? It's just something that we can use to communicate within the hospital, within staff. We also have Making Moments Matter, which is not on here, but that's another tool that we have. And that's something that you can congratulate your team members on. Like when somebody has a birthday, you can say, happy birthday to such and such and send it to them. Or you can say, you know, saw you had a rough day today, just want to take yourself out and send them some encouraging words. And then we also have, Randa's putting out the nursing newsletter. I'm not sure how often she's putting that out, but that's something else to look out as well. And then, of course, we also have our websites. And we try to keep that up to date as well with the news section. If you ever have a question, what's going on with the press releases and stuff that we put out into the paper. That's all I have.
All right, thank you, David, and thank you for keeping all these platforms up and going and moving. I know it's a very challenging to keep all these platforms up and going, so thank you.
Thank you.
We're going to move forward with celebrations. So we've celebrated a lot in this first quarter. We celebrated 5 Leapfrog A scores. Our new score will come out here soon. We can't announce it yet till May, but I'll just say we're excited about it, and we're going to celebrate again. We also have our sepsis certification that we received in January of this year for a job well done. We also have our Zero Hero Award. So both Fleming and Meadowview celebrated 0 hospital-acquired preventable infections for all of 25. So kudos to each and every one of you for making sure that we have a clean facility for our patients and that we are able to get catheters out timely and just get patients out of bed and mobile so that way we do not have any healthcare-acquired infections. Also celebrated Brandon Richardson in the first quarter for the Daisy Award winner. So thank you to Brandon for his job well done. I do round on the 3rd floor and I often hear patients sing his praises. So thank you for that. Continuing on, we have our residency program that we have in place with Primary Plus. So if any of you all see these individuals throughout the hospital or in offices, know that they are a part of the residency program with Primary Plus. They will have a completed program that'll be a 3-year rotation. So the ones that you see now on your screen are all of our year 2s. In July, they will move to year 3. When they come out the next July, they will be full doctors and hopefully they will remain in our community. The next group that you see here is all of our residents that are with us that are currently year 1s. They will move to year 2. And we do look forward to working with them as they continue on their journey to become a doctor. Some of the new things that we've had and new providers we've had join us in 25 and the first part of 26. In the top on the right, you'll see Lydia Floyd, and then on the top right on the bottom, or the bottom right, you will see Dr. Lambros. They both joined us for our gastro group. Lydia joined in July, and then Lambros joined in the fall. They both completed our service line there with Dr. Weller. Corey Shotwell, who you see on the top left, he is able to read cardiac CCTAs for us. He will join us full-time in 2027 as an interventional cardiologist. He will join Dr. Lohman, Mitch, and Laura in their practice full-time next year. But between now and then, they can read cardiac CCTAs. Dr. Boyd, you will see on the bottom right, he is a family practice physician that has been practicing in the Flemingsburg community, and he is now joining us on April 20th. He will become employed. Our group that we had in Flemingsburg with Dawn, Victoria, and Julia, they will join Dr. Boyd in his practice as well. In the top middle, you will see Dr. Smith. He is a bariatric surgeon that is part with the LifePoint Centerpoint group out of Georgetown. They started a bariatric clinic here a few Mondays ago at Meadowview. So if you have any patients that are interested in bariatric procedures or medication, they can see them in their clinic, which is in the general surgery practice here at Meadowview. They're currently seeing patients on Mondays, and they will expand as it grows. Any surgery candidates, they can get all their labs, imaging, and scopes done here prior to the surgery, but any surgeries for the bariatric procedures will take place at Georgetown. We have assigned 2 hospitalists. Dr. Confidence will start with us in July, and then Dr. Biswalls, who is our medical director, she will actually start with us in the fall of 26. We currently have some general surgery locums filling that need with Dr. Peppers, Dr. Lawrence, and Dr. Bennett. Lawrence and Bennett are already have privileges, and then Peppers hopefully will have privileges in the upcoming weeks. All right, Kyle, I'm going to turn it over to you to review social media guidelines.
Thanks, Kathy. I just wanted to go over some of our social media guidelines, and these come straight from our employee handbook that can be found on the First Up app. So first, all employees of LifePoint Health facilities can maintain their own social media accounts. LifePoint Health and its facilities are not responsible for any negative outcome generated by an individual employee's social media commentary. Employees should not act as a spokesperson for the hospital. Employees should not post hospital matters that are proprietary in nature, meaning information that has been seen as financial, operational, legal, or otherwise may include protective health information, and proprietary information is any business-related information that can be perceived as business information or information that can be true, untrue, or partially true information coming from the poster on social media. What is posted online is important, and it can have a direct, lasting impact on the hospital, the employees, and the community, and the patients. Once information has been posted, the information can be available forever and saved by others for future use against the employee or the hospital. So always keep that in mind. We expect our employees' behavior to reflect our core values, both in person and social media postings and other interactions. If it is not something that you would say in the middle of a stadium with a bullhorn, then it's probably best not to say it on social media. Report any concerning social media posts to your local people services, which that would be myself and Catherine. And we will be able to address those comments with the individual in the appropriate manner. Many social media posts get sent to admin, HR, and LifePoint. And always keep in mind that many companies, not just LifePoint, use geo-tracking and can see posts that anybody posts because of that geo-tracking. And be mindful, one inappropriate post can create long-term consequences for the hospital and for the employee. And that's all.
All right, thank you, Kyle. I appreciate it. All right, next we're going to review what's new in 2026. So wound care, you'll see in the top middle there, that is our billboard that's going up in Fleming County to support that service line. We have Roger Owens and Dr. Stieber. They are currently seeing patients in the wound care. We have furthered our relationship with the University of Kentucky Healthcare Center. We are marquee cancer affiliates as well as Gill Heart and Vascular Institute affiliates with those programs. So it's just better aligns us. If we have patients that have a higher need for care, we have a good relationship with them to get the patient transferred to that location and receive the care they need. In the bottom left, you'll see a picture of what's called Viz AI. So Viz AI is AI technology that sits on our CT scanner, both at Meadowview and at Fleming. And it looks for any clots or bleeds when we have a patient experiencing stroke-like symptoms. The way this works is the technology sits on the scanner, patient is scanned, it sends the images to the neurosurgeons at the University of Kentucky. They then review the images and they report back to the ER physician if they see a clot or a bleed, and they give instructions. So if they do see a patient with a clot or bleed, they give instructions to send the patient to the University of Kentucky, so that way they can receive further care. If they do not see a clot or a bleed, we can keep those patients here close to home, and they provide initial orders. The great thing about this technology, if you have a patient that does have stroke-like symptoms and they stop here at Meadowview or at Fleming and they have the scan, if the neurosurgeons see a clot, it's an automatic acceptance to get the patient there to them. And while you're on the way there, they're setting up the OR and you arrive directly to that facility and go to the OR. You don't stop anywhere else. So that way we can expedite the care. In the middle, you will see a picture of AI technology that we've installed on our MRI. You did hear earlier that we're getting a new MRI. However, that will take many months to get into place. So between now and then, we have access to the Settle program that enhances the images, and it also reduces the time. If you see down there on your screen a scan image that would take a minute and 46 seconds in the past, it now only takes 42 seconds. So anybody that's had an MRI knows that you do not want to be in that scanner any longer than you have to. So with us installing this technology, a scan that previously took 30 minutes now only takes 15 minutes. So it gets the patients in and out quicker. It also allows us to see more patients in the day. On the right, you will see a picture of Dr. Dreyfus. He is the leader for the Exceed group that we have at night that is now covering our hospital. So Exceed is our hospitalist coverage at night. They are board certified intensivists that we have available to us during those overnight hours. The team, the rollout actually took place January 5th. And so far, the feedback has been very good about the care that they're able to provide. We've increased the patients that we've been able to admit here, 94 over prior year, just because we're able to say yes to some of those critical patients and we can keep them close to home. On the next page, we have some items that are coming soon. So some of this, because we presented this in March and it's now April, some of this has changed slightly. So the Kentucky Bariatric Institute is already live here on campus. Virtue Care is what you see in the bottom middle there. That is a group that is urology that we will have coverage starting July is our goal. We will have a mid-level that will see patients out of Dr. Dickerson's old office. They will be here Monday through Friday. And then we will have a urologist on site doing procedures in the OR starting 1 day a week, but then growing that as the volume continues to grow. In the top right, you will see a picture of a cardiac CCTA, and that is a way to look inside your heart to look for any blockages. So Corey Shotwell, as we talked about before, he will begin reading those. They will start in May. We do have a contract now signed with DaVita for dialysis, so looking to get that in place in-house. It'll be coverage Monday through Friday. In the bottom left, you will see a picture of rehab. Looking to reopen rehab services at Fleming, we did hire a full-time occupational therapist and just continuing to work to fill other physical therapists and a speech therapist so we can get that back open. In the bottom right, you will see a picture of the OR. We do look to open the OR at Fleming. We are looking to start with podiatry and pain to start with. And then if you look in the top left, you will see STEM. That is going to be our telemedicine group for neurology, nephrology, and pulmonary critical care. So that way we can keep patients close to home and see sicker patients. So today, just wanted to thank you and all that you do each and every day. We know that healthcare is not a place that is easy to come in and work. It's hard work. You're taking care of patients. So for me and the leadership group, just want to say thank you, and we welcome any feedback on how this town hall was recorded, presented, to see if we have room for improvement moving forward. But thank you again. And then to the rest of my group, anybody have anything else to say before we sign off?
We do have 0 bars down here if you want to need some. Come and get them.
Yeah.
Just thank you to everybody for their hard work.
Yes, thank you.
Yep. And on behalf of the IT, we appreciate your patience with us.
All right. Well, thank you all. Have a good rest of your day.
Thank you.